This is a brief introductory video to pharmacogenetic medical DNA testing that Merogenomics is offering access to. In essence, pharmacogenetic testing premise is to decode your DNA in order to learn how ideally you should be using your medications. And the purpose of that is to be able to use medications more effectively. The way this can be achieved is through, first and foremost, improved dosing of your medication, as well as some cases we can learn about potential toxicity profile of medications based on your personal genetics. Dosing is the most common application. And while there are multiple different factors that might affect how the dosing of medication should be aligned specifically to you based on your personal genetics, most often that information comes from learning how you would metabolize the medications that are linked to pharmacogenetic information. And to briefly review this, most medications are assigned to people based on the assumption that they are normal metabolizers, but that not necessarily is always the case, and people can be both either rapid metabolizers or ultra rapid metabolizers, and the opposite can also be true. They can be intermediate metabolizers or poor metabolizers. So you can imagine, depending which spectrum you fall into, you could either break down the drug that is given to you very rapidly so that the drug is not even effective, or you could be breaking down the drug so slowly that the medication would run the risk of potentially producing some toxic side effects. So let's review what kind of medical specialties are covered by medications which are linked to personal genetics, and these are listed right here, where the percentages listed indicate how many drugs of all the pharmacogenetic linked drugs are involved in that specific medical specialty. So you can see that cancer and psychiatry have the largest number of medications that can be linked to personal genetics, and therefore these two target groups are of greatest benefit to use pharmacogenetic testing. Another way to look at this is to see what kind of conditions or symptoms might be covered with medications that can be linked to your personal genetics, and these are being listed here. So if you do see any of these conditions or symptoms that apply to you, pharmacogenetic DNA testing might be of interest to you. And then finally, here is a list of the medications that are actually linked to personal genetics, and this is a very large list and only includes medications with the highest degree of scientific evidence that pharmacogenetic information can be linked to how you as a person could be potentially be affected by these medications. This list can be larger than that, but we wanted to show you here the ones that already have the highest degree of evidence. So if you do see a medication that you are on this list, it might be of great interest for you as well to consider pharmacogenetic DNA testing, because you could potentially be altering how you need to use that medication. What we might also want to add here, once again, the most prominent target groups that can benefit from pharmacogenetic testing are cancer patients, because approximately 50 of these medications that can be given to that target group are already linked to pharmacogenetic testing. And another group, once again, is those who might be treated for mental health conditions that might include depression as well as anxiety. And the reason why is because that particular target group has the highest risk of potentially needing to try yet another medication. And once again, there's approximately 50 medications that can be already linked to personal genetics. So such target group could potentially avoid going through unnecessary trial and error. Additional reasons why you might consider using pharmacogenetic testing is if you are taking multiple medications. And the reason for that is because sometimes one medication can influence performance of another. If you have any dangerous comorbidities, you might also consider testing yourself to see how genetics might be influencing your medications. And the reason why is because associated comorbidities do increase the risk of experiencing toxic side effects from medications. Also, old age is the highest risk factor towards experiencing adverse effects from medications. Also, if you are undergoing surgery, you might consider using pharmacogenetic testing to select the best medications for you for that purpose. Then the last point we'll bring up is that if the medication that is to be prescribed to you is already known to be linked to potentially toxic side effects, you might use pharmacogenetic testing in order to select a different option. Alternatively, if you have already used a medication in the past and experienced toxic side effects, once again, you might use pharmacogenetic testing in order to select another one. So I hope this video helps you determine whether pharmacogenetic testing is a great test for you.